Welcome back to our final presentation of the day that will be coming from Dr. Jaishree Naidoo, who is the CEO and co-founder of Envision It Deep AI. As I've said, Jaishree is the CEO and co-founder of Envision It Deep AI, an innovative medical technology company that utilizes AI to streamline and improve medical imaging diagnosis. She is a pediatric radiologist and a dedicated medical specialist who has served the state healthcare system for 20 years. So she has massive experience in that. She'll be talking about artificial intelligence to clinical intelligence. I will hand over to Jaishree. Let me inform you that this is a pre-recorded presentation.
Greetings, everyone. I am Dr. Jaishree Naidoo, and it is my pleasure to speak to you today from artificial intelligence to medical intelligence. So we've seen the headlines, AI beats a human, or AI is replacing, taking over. And also remember the recent shocking statement by Prof. Jeffrey Hinton, who is a prominent figure of deep learning and artificial intelligence. During a machine learning conference in Toronto, he recommended that hospitals should stop training radiologists because deep learning will replace them. So while such headlines reveal how much exciting progress has been made in artificial intelligence, they can also be misleading, as they suggest a false dichotomy that it's one against the other. Now let's put this into perspective. Africa is a continent with a population of 1.2 billion people, and more than half the population is under the age of 15. And there's a significant disparity when you look at the number of pediatric subspecialists there are on the continent. There is a significant burden of disease that exists on the continent, with TB and HIV highly endemic. Pneumonia is also the #1 cause of death in children under the age of 5. And due to this dependency on medical imaging, there's an increased need for rapid throughput processing, high volumes of medical imaging. Also to note that 1.5 million people die of misdiagnosis globally. Now, we know that Africa is the youngest continent in the world, but there are less than 20 pediatric radiologists on the continent, and they are concentrated in only 7 countries in Africa, and it takes 14 years to qualify. Now, looking at the UK healthcare system, and this is from the Clinical Radiology UK Workforce Consensus Report in 2019, 100,000 imaging exams are carried out in the UK each day. 40.1 million imaging requests in England alone between June 2019 and May 2020, and 1.9 million images in May 2020, where almost half of this is chest x-rays. The 330,000 patients are waiting more than a month for the results of their x-rays. Now, a delay in the reporting of these images are potentially linked to a delay in the diagnosis of cancer and other serious illnesses. And looking at the financial costs, the radiology department spent an estimate of £193 million in 2019, outsourcing the reporting work to commercial private companies. And so there are high volumes of medical attention needed, but there's minimal reach. And the healthcare services are under-resourced and overused. And healthcare providers globally are challenged by the significant burden of disease. And due to the advances in diagnostic imaging, there is a demand on radiologists to report on cross-sectional imaging, and this is increasing. So it puts a significant constraint on radiologists and doctors to work more accurately, efficiently, and timelessly in order to provide the best diagnosis and treatment plans for their patients. So they're often stuck in a dark room and losing their patient interaction in order to deal with these increasing demands. And so this brings me to the story about Lester Wyatt, who worked as a detective for the Salt Lake Police Force. And in 1912, he was appointed to head the first traffic squad at the age of 24. And as head of the traffic squad, he created the first regulation codes and appointed patrolmen at the busy streets, manning traffic in each way and in all types of weather conditions. As a result, they were not able to do their work as policemen. But Lester wanted a better way to control the traffic, and he wanted to allow cops to do the work they were meant to do. And so in 1912, he went on to invent the first electric traffic light in Salt Lake City. So flash to the future, and to this day, Lester Wyatt's drive to find a solution is still being used. So imagine the opportunity it gave to policemen and to traffic officers, no longer needing to stand in traffic in all sorts of weather conditions. So it's allowed cops to do what they do best. And so this relates to my own personal journey, having spent 20 years in public healthcare. And in 2010, I became the first South African trained pediatric radiologist, where I commissioned pediatric radiology departments and participated in outreach efforts in order to upskill radiology training. But I realized through the years, and despite my efforts, that human capacity alone cannot solve the challenges we face on the continent. And nobody knows Africa's challenges like we do. And out of these challenges or difficulties comes innovative solutions. So I knew that we could use technology to augment and multiply our role. So we developed an AI platform that will streamline and augment the radiology reading of diagnostic images and relieve the bottlenecks we face in medical imaging diagnosis. So we're not only excited about discovering and developing new tools, but also in delivering them to the people who need it most. So I believe in the human-cybernetic relationship, where AI is an augmentation tool to empower doctors to work faster, more accurately, and to prioritize life-threatening cases and provide a more patient-centric approach. Now, to better understand AI models, let's go back to understanding what is artificial intelligence. So artificial intelligence is the ability of a machine or a program, a computer program, to think and to learn. Now, these artificial neural networks are inspired by neural networks in the brain, where a neuron is a basic unit of computation in a neural network, and it's a cell that processes and transmits information. Now, in radiology currently, the primary machine learning algorithm type is the artificial neural network. And similar to how neurons in the brain are organized in layers, neurons in neural networks are organized in layers as well, where you have the input layer, which communicates to one or more hidden layers. And this is where the actual processing is done via a system of weighted connections. And the hidden layers then link to an output layer where the answer is the output. Now, combining these features produce an estimation of patterns that is inherent in the data. And as complex as it sounds, it's what humans do every day. But when machines do it, it's called artificial intelligence. Now, deep learning is machine learning on steroids, where you have supervised and unsupervised learning. Typically, it takes around a minute for a doctor or radiologist to label an X-ray. With a sophisticated AI system, it can label 2,000 X-rays in a minute. So it's 2,000 times faster than a human being. So now let's look at how an AI model can be integrated into a radiology workflow. We can start by looking at a typical scenario without artificial intelligence. So we have a patient that goes to a medical doctor for symptoms such as cough and fever. The doctor examines the patient and orders an X-ray. This patient then goes to the radiology department, has an X-ray exam. The image then is taken and is transferred to the PACS, which is the archiving system for all exams taken in radiology. The X-ray is then picked up by radiologists on a queuing system, so it's not prioritized. The radiologist examines the X-ray. He then provides the report, which fully reports the images, and the report is then sent to the patient and to the referring doctor. So this can actually take a few minutes, sometimes a few hours. Now, let's look at when you use an artificial intelligence system. So the image is taken, and that image can be taken and sent directly to the AI via the modality or directly from the PACS system. The image is then processed, and it is done in under 20 milliseconds. This processed image is then made immediately available to the referring doctor. It is triaged as well in order of urgency and importance to the radiologist. The report is also pre-populated with the findings, and the radiologist validates and it's sent through to the referring doctor. This is done in a matter of seconds, and it's immediately available so that the referring doctor can provide instant treatment. So looking at without an AI system versus with an AI system, there is a significant reduction in the turnaround time. So we are now seeing how the COVID-19 pandemic is having a devastating impact on the healthcare system. So an AI solution that detects signs of COVID pneumonia is used to triage high probability cases so that these patients can be isolated and receive immediate care. Now, tuberculosis is also another public health concern and is highly endemic in sub-Saharan Africa. The epidemiology of TB is also adversely impacted by the HIV virus co-infection, where mortality is higher. Artificial intelligence models are now available to augment the interpretation of digital chest radiography for TB. In fact, the WHO has recently updated their recommendations for TB screening to now include the use of computer-aided detection. Breast cancer is the most common cancer affecting women worldwide, and AI models in mammography can assist with the double reading and in detecting early signs of breast cancer. Ultrasound is a relatively inexpensive and it's a portable mode used in diagnosis. The procedure is non-invasive and quickly gives radiologists information that is necessary to make a diagnosis. These ultrasound machines are being made smaller and smaller, making them more accessible to lower resource countries. So an AI model that is integrated with a mobile ultrasound solution will achieve radiology level performance at the point of care. And as such, it can deliver impactful, feasible medical solutions, especially in these under-resourced communities. So there are many applications to use artificial intelligence in diagnostic imaging. We have covered AI in breast cancer screening, AI in chest imaging for infectious diseases, but it can also be used in lung nodule detection, in the detection of pulmonary embolus on CT chest imaging, in imaging of the brain. It can be used in early stroke detection, which is life-saving. In musculoskeletal imaging, it assists in identifying fractures and bone age estimation in young children. Abdominal imaging, artificial intelligence can be used to detect masses and tumors, and through segmentation techniques, quantification of these tumors can assist in pre-surgical planning. Now, in terms of research and training, AI can be useful as an intelligent case-solving platform for trainees and radiology specialists. AI that is integrated with conventional radiology education will improve radiology practice and drive academia, especially those who are working in remote areas who want the benefits of continuous medical education. These images depict the use of our artificial intelligence model, which was gamified and used in preparing final radiology residents for their exams. So we know that machine learning has the potential as a clinical decision support system, but not only in detecting and in interpretation of findings, they can also help and improve the different steps of the radiology workflow, including ordering, scheduling, triage, post-processing and dose estimation, examining the quality assurance of the images, as well as assistance in imaging protocol selection. And finally, it can assist in the business and improve the business intelligence of a practice. Now, in terms of new emerging applications of artificial intelligence in imaging, by combining the different types of imaging data with genetic data, can really bring about better diagnosis and therapy. And so this discipline of radiogenomics connects images with gene expression patterns, and together with machine learning approaches can be used to study the impact of genomic variations on the sensitivity of normal tissue to tumor tissue to radiation. And so this is an emerging field in precision radiation oncology and could really facilitate the development of a personalized treatment plan for each patient on an individual basis. So with artificial intelligence, the spread of knowledge and technology will intensify. It will be transformative, and it will help us solve some of the challenges that we were not able to solve before. However, no algorithm is perfect, no matter how much you train it. And so the best team and the best solution is to take an algorithm and supplement it with experts. So the integration of artificial intelligence into existing medical workflow is promising. And the future will have AI embedded in so many clinical decisions, as well as hospital administrative processes. It will no longer be called artificial intelligence, but rather medical intelligence. So in this way, you have the experience of a human and the accuracy and the efficiency of the algorithm, which is the human-cybernetic relationship. However, as with any new innovative solution, there will be some barriers to encounter. And in Africa, we have network and broadband challenges, as well as poor accessibility to imaging in rural areas. Now, these connectivity or network issues in Africa can be avoided and overcome by providing on-site and light solutions. From this slide, you can see that it takes many years to train as a medical specialist. So who is ultimately responsible and liable? Is it the AI vendor? Is it the doctor? Is it the artificial or the algorithm? And so this can really amplify complex ethical and societal issues. And the radiology community are coming together and are developing new codes of ethics and practice for artificial intelligence. This statement by the Joint European and North American Society highlights the consensus that the ethical use of AI in radiology should always promote well-being, minimize harm, and ensure that the benefits and harms are distributed among the stakeholders in a justified manner. And so lastly, what do you do about pushback from those who don't understand artificial intelligence or fear that it may replace them? And so coming back to those headlines we spoke about earlier, how do we change culture? So Socrates says that the secret of change is to focus all your energy not on fighting the old, but on building the new. So radiologists will not be replaced by artificial intelligence, but rather by radiologists who use artificial intelligence. The current healthcare crisis has definitely brought to the forefront the need for innovative collaboration in providing a more universal and democratized healthcare. And so coming back to this image, none of us wanted to be stuck in a dark room. We can all be part of the change, and artificial intelligence can be used to empower doctors to prioritize life-threatening cases and offer a more patient-centric model of healthcare delivery. So allowing them to interact with their patients and other doctors to discuss treatment plans. And with the continued use of technology in healthcare in Africa, we can move from a more proactive healthcare system than the current reactive one. Thank you so much for your attention.
Thank you so much for the presentation from Dr. Jaishree. Naidoo, very informative and well executed, talking about how to detect stroke, AI in ultrasound, AI in mammograms, detection of tumors. We are so grateful of how healthcare is integrating AI in saving lives from all these diseases. And this brings us to an end to our AI in healthcare. And we'd like to thank all our speakers who graced us today, who shared such powerful presentations. And we thank all the attendees that really came through, even in these challenging times whereby we are suffering scheduled 4 of load shedding. And we really appreciate your presence. I've been getting a lot of emails. Most people were failing to come through because they didn't have electricity. And they've been asking if they'll be getting some sort of link to the videos. Yes, that's correct. As soon as we get the links, we will share it out to those people who couldn't attend or even to our attendees. They'll be having those links towards our video for the summit. I would like to say thank you very much. And this brings us to an end. You have a great day and stay safe. We shall meet in our next conference. That will be AI in retail. And thank you, Machine Learning Africa, for hosting us. We really appreciate. Thank you. We shall see you guys next time.